Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I am the Dean at the Arizona College of Podiatric Medicine, and we have an exciting show for you today. My guest is Dr. Jonathan Leibovitz, the Dean at Western University's College of Podiatric Medicine. He is an educational innovator. He's played a significant role in the Western University College of Podiatric Medicine since its inception back in 2009. Dr. Leibovitz did his undergraduate studies at Cornell University. He did his Doctor of Podiatric Medicine at Temple University, and he did his residency at Botsford General Hospital. Welcome to the show, Dr. Leibovitz.
Thank you, Jeff.
We're going to go with a fireside chat theme, John. And so going forward, let's go. Well, you're John, I'm Jeff for the rest of this show.
Sounds great.
So just to get started, could you take a couple minutes and tell our audience a little bit about you, both professionally and personally?
Sure. Thank you. And first, thanks for having me on the show today.
Oh, pleasure.
So I grew up in Washington, D.C. area in the suburbs in Maryland, very suburban life, and played sports growing up. Went on to college at Cornell University, as you said. I studied biochemistry there, nutritional biochemistry, actually. And then went on to Temple in Philadelphia for podiatric medicine. I was fortunate at the time. We didn't have many 3-year residency programs. Now everybody gets that, which is a great change in our field. But I was fortunate at the time to get a program there at Botsford General Hospital. So I moved to Michigan, a place I never thought I would live in, and ventured out into the cold and did 3 years there. I was very fortunate to then go on to Austria, where I did a fellowship in orthopedic trauma surgery. It was a great experience. It really gave me a great appreciation for how lucky and fortunate we are with so many things. When you see trauma all the time and severe polytrauma all the time, with life and death matters all the time. It was really an eye-opening experience. Put a lot of things in perspective.
Very good.
And then I came out to California.
Oh, so
started my practice.
So tell me a little bit about your family.
So I grew up in DC, as I mentioned. I have an older brother. We went through school together, went through Cornell together. He then went on to Philadelphia a year before me for graduate school. So then I followed him to Philadelphia, I guess. But then when I came out to California, I met my wife, and I have a daughter, and then I have a younger son. They're now 21 and 18.
Wow.
So we're close to being empty nesters. Another year with my son at home, and then we're empty nesters.
Oh, very good. Yeah, my wife and I became empty nesters a couple of years ago, and it's a whole new world, that's for sure. So John,
it seems like it will be.
John, before we get into talking about the colleges and all the different topics, I want to talk to you a little bit about leadership. You and I have been in a lot of meetings together, and I've always been impressed with your insightfulness and your thoughtfulness and your diligence and how you eloquently attack problems. Where did you get those leadership skills from?
I think a lot of it came from observing, from listening. And primarily it's from my father initially. Growing up was a large impression on me in that sense. And also my mother. My father worked for the government. He was a senior executive in the Defense Department. And just, hearing him, he couldn't talk about work. But when he did, it was about managing people. It was about talking about people, about leading people, because he couldn't talk about things he was doing. But then also for my mother, she was an elementary school educator. And to hear how she managed 36-year-olds or 5-year-olds is beyond me. I still don't understand how you do that. But to manage people who don't necessarily think logically yet is a really hard task if we go back and think about it. And you can learn a lot from that. And I don't think I realized some of that until much later, that you can learn from everybody and every role is important.
Absolutely.
And I think that's one of the biggest principles of leadership.
Absolutely. My mom was also an elementary school teacher, and I always was marveled at how she could herd all the little kids around to do what they needed to do. So in essence, leadership is there's a little bit of an innate nature and there's a little bit of an acquired nature to it, it sounds like.
Yeah, absolutely. And a lot of listening.
So, there's that old saying, leaders do the right thing and managers do things right. And as deans, we've got a lot of balls in the air at any given time. What percentage of your time do you think you're fulfilling the role of leader, doing the right thing? And then what percentage of your time are you a manager doing things right?
That's a tough question because I think it changes every day.
It does.
But I think I'm very fortunate. I have a great team. So that allows me to lean towards doing the right, doing things right, or leading and doing the right thing, I should say.
Right.
But managing, I would say, still comes in a good 40% of the time, because no matter where you turn, somebody else has a problem that they need you to help them solve. So I don't get to work on my own issues that I have to solve. I have to help them with theirs. So managing always comes into it, no matter what we do.
Absolutely. I've thought about that too. And I think when you first take on the role as dean, there's an elevated leadership role as you get the train on the track, so to speak. But there's always the management and making sure things are done right. And I think when I first started being a dean, maybe it was 70-30. And now I think it's, sometimes 60-40, 50-50, because once the train's on the track, then you just got to make everything work. Right.
And I'm newer in the role, so I'm still trying to navigate that strategy of where we want to go and how we want to do things a little differently. So.
No, that's a great opportunity, and it's a great opportunity for the college.
Yeah.
I'd like to talk about your role and how it's evolved at Western. But before we did that, I wanted to ask you how you were introduced to podiatric medicine.
So I was introduced real early on, but I didn't consider it yet as a profession. Early on, I grew up with a friend of mine whose father was the team podiatrist for the Washington Bullets, now Washington Wizards, I guess. And so I grew up going into the locker room with and meeting Wes Unseld and Elvin Hayes, and back in the 70s when the team was good.
Sure.
So, and then, I would stay in touch with him as time went on, and more with his father professionally as I got into the field. But back in college, I was looking at medical school, and I started to kind of remember podiatric medical school, and maybe that was an option. And a good friend of my father's growing up was a podiatrist in Buffalo. And he was very influential on me in some discussions we had as I was in college, and kind of swayed me into this field. And I kind of pursued it from there.
So when you first got into it, were you looking at sports medicine? It sounds like that was an area of expertise. Did you ever imagine you'd get into an administrative role?
I never imagined an administrative role. I don't know if any of us thought like one day I aspired to be a dean. But no, I thought sports medicine was it. I loved playing sports, and I realized there are very few people at the top of the pyramid who actually make it. So I was always told the best way to do it is go be the team doctor. So I loved sports. I wanted to be a part of it. So anything I did, I wanted to be affiliated with sports in some way. And that was the plan.
I think that's true for a lot of our students coming in. They've got visions of surgery and sports medicine. And then once they get into the profession, they understand all the different other areas they can become an expert in, whether it's wound care, whether it's pediatric foot issues. And there's lots of different variables that we can get involved in. So when you were going through Botsford in your 3 years of training, leading into your AO trauma fellowship, who were some of your mentors in the profession?
Well, I think the biggest mentor I had was Marshall Solomon, my residency director. And Marshall is still a mentor to me. I don't know if he realizes that. He would probably deny that, most likely, because he's very humble too. But has so much integrity. Very bright person, great leader himself. And he really showed us all as residents what it meant to give back. You don't go to practice every day and that's your life. You give back. And he was very involved in the field. He still is. And that really kind of inspired a lot of us to give back. My co-resident was president of his state association. We've all done different things to give back. And very inspiring.
I agree. And it's interesting because Detroit is currently and always has been a hotbed for our profession. I did my residency at Kern Hospital, and we would do joint educational opportunities with the other hospitals. And I thought it was a very collaborative environment, and I think it made all of us better.
It did. I was very impressed with how the programs all worked together. We had monthly conferences. We had all sorts of activities that we could do to learn from each other. And it was a great opportunity.
Do you mind delving a little bit further into your fellowship, the duration of it, how you got connected, some of the more interesting cases? You would briefly mention them, but I think that is such a tremendous opportunity. And then maybe after that, we can talk about fellowship opportunities and how we're advising our students today.
Sure. So I first learned of the AO fellowship early in residency. At the time, it was an orthopedic fellowship program. For anywhere from 1 to 3 months, international programs. And you applied and then you don't hear back for, say, 9 months. Actually, someone a year before me, she had done the same fellowship. So I applied and learned a lot more through her process the year before. So after I applied, and I thought it would be great to go internationally, and I'm going to go to either UK or I'll go to Australia because they'll speak English in the operating room. And I applied and I got a call 9 months later, do you want this? You're going to go to Austria. And my first response was, this is great. I'm going to Australia. And she said, no, I'm going to Austria. Like, well, Graz, Austria, where's that? I'm going, but where is that? I mean, they only took 2 of us. How could I turn it down? So I find myself in Austria. I hadn't spoken German since high school, many years before, and I was never good at it then. So it was a real experience. Most people speak English. So that was very helpful. Most of the nurses did not. So it made the operating room a little more interesting. But it was just a great experience. I mean, culturally, life experience. And obviously the trauma and surgical training was just phenomenal. In Austria, they happen to only have 3 main trauma centers in the country. And I was one of those. So patients flown in from all over the country, all the time.
Wow.
So it was fascinating.
What a phenomenal experience.
Yeah, it was really a great experience.
Are you recommending to students when they come back for your guidance after they're doing 2 in their 2nd or 3rd year of residency programs, are you recommending that they do a fellowship?
I do for some. I don't strongly recommend it for most because I think most of the 3-year school residency programs give you a really good training to go out and do what you need to do. I feel that a fellowship is either 1 or 2 people really should go to a fellowship. Someone who really has a passion for one thing and they want to just get extra training in a focused area, whether it be a sports medicine or a limb salvage type of program, specific microsurgery or reconstructive thing. Otherwise, I recommend it only if there's some area that you don't feel you're comfortable with yet and you really still want to be able to do that in your practice. Maybe ankle, replacements or something. And you've done 1 in 3 years. Well, you should not do them if you've done 1. That's not a procedure you should be doing on a regular basis. So, I would recommend that type of person go out and seek extra training, and a fellowship's a great way to do that.
Absolutely. When I was in Miami, Dr. Jim Lucido was the Miami Heat doc. And he always had a sports medicine fellowship. And one of the opportunities the fellows got is they got to go to every home game for the Miami Heat. And I thought, hey, I want to apply for that fellowship.
Right. That would be a great one.
Absolutely. We'll get Dr. Lucido on one of these days to talk about his fellowship too. So, John, let's move on to your work at Western University in the College of Podiatric Medicine. It's amazing the amount of work. It's daunting that goes into starting a new College of Podiatric Medicine. And as you know, we have 2 new schools that came on board this year. So now there's 11. One is in Texas in Rio Grande Valley, and the other one is at LECOM in Ohio. And you've lived that life, right? You came into to Western back in 2009, and you've seen the college from its inception. Share with us a little bit about those early days. You were an assistant professor, how you got that job, and the roles you filled, and how that's played out over the years.
Yeah, boy, was that an experience. I wish the other 2 schools a lot of luck, and happy to help them, but it's an experience. So I got involved because Dr. Lester Jones was at the school. He was our associate dean at the time, and he and I had known each other for a long time, since I first moved to California to practice. So he called me and asked if I would come on board and teach. So I came on as an assistant professor the first year, just part-time. And about 6 months in, they asked me to leave the practice and come full-time and come on and take on the role as department chair. So I did, and that's how I started full-time at the university in 2010, and I've been there ever since. It was a lot of hard work at short notice, pushing deadlines every day, trying to get the next piece of curriculum developed and written in time for the student for the next class. You're really just trying to play catch up, and it's a real tall task. Thankfully, now we're just in a very different position that way, and you can see there are other stressors. There are new challenges that we deal with, like you do, I'm sure, and everybody else. But it's not the pressure of we don't have a class. We have a class to teach, and we have nothing to teach. So it's a lot more comfortable that way.
Absolutely. So when you went from an assistant professor, then you were an associate professor, and you played multiple roles within the college, including director of clinical education. What advice would you give to a young practitioner that is thinking about a career in academics? I get a lot of phone calls. I get a lot of emails. Young practitioners will send me their CVs. Having been through it yourself, what recommendations do you give to the young practitioner that envisions a future in academics?
I think the biggest thing is a reality check. A lot of people, certainly when I went to school, a lot of people felt that was a place for people who couldn't sustain a practice. We'd all kind of just drift into academia because you were protected and it was easier. And I would tell you, it's not easier. Many times it's harder. I thought it was challenging time-wise to run a practice. And I was part of a very successful practice. But time-wise, and just the extent of being a mill to run patients through sometimes is the feeling you get in private practice. But academia is more variety. Because you're doing scholarly activity, you're researching your publications, you're teaching, you're mentoring, you have office hours, you're preparing lectures, and then you still have to see your patients because we have clinical teaching responsibilities. So there's more variety, and you're often pulled in multiple directions to do all of those at the same time. So don't come here if you think it's easier. That's the biggest piece of advice I would give you.
I agree with you 100%.
And I think with that reality check, if they're still interested, then I think anybody can then do it because you have the right motivation, the right intention. And if you have that, you've made it this far, I think most people can be successful at it.
I agree. So in my eyes, looking at your career, maybe the big jump was going from being a faculty member to all of a sudden being an administrator and being a dean, and
right.
Your roles and priorities change. What does a typical day in the life of the dean at Western University College of Podiatric Medicine look like?
It's funny you say typical day. I don't think there's a typical day.
Right.
I think that's the first thing that people have to realize. If I were to try and classify something as typical, it's listening to everyone's complaints. Student, faculty, staff, whomever. Every once in a while, a parent maybe, which is kind of surprising at this point in a professional career, but it can happen. So it's listening to complaints and knowing when to act and when people want to be heard.
Yep.
And that's sometimes a really fine line. It goes back to your leadership question. When do people just want to be heard? And when do they actually want you to step up and do something? And we don't always have that answer, but we can try. But going back to a typical day, I think a lot of it is fielding that. It's just meeting after meeting sometimes. People don't always realize how many meetings that the dean has at the university level, different committees we serve on, and then still trying to manage and to lead the college in different strategic directions. But you have to make sure day-to-day operations happen. The budget, the teaching and the education's going in the right direction. And like I said, I have a great team. I don't have to look over their shoulder. I know if we have to make sure something happens, it's going to happen. My leadership team is fantastic.
I feel blessed in the same way. I've got a phenomenal leadership team. It's funny because I got in the habit of getting up really early in the morning, taking care of all the busy work, because I always believe that I never know what's going to hit you when you come in the door that day, right? So I agree with you. I mean, every day is a little bit different, and there's ebbs and flows to academics, of course. The ebbs and flows in practice are more day to day, and the ebbs and flows of being a dean are more annual. You've got your cycles, of course, but it's just a different kind of skill set. There's no question about that.
You really have to be on top of the organizational skills. Absolutely.
So now let's talk about our reason for existence, students and their education. How do you put students first? That's my belief. Students come first, and then we work around on their needs and their education and setting the stage for them to go into residency programs. But what are some of the things you do at Western to really put the students first and enhance their educational experience?
Well, I think the biggest thing is, it goes back to what I said before, listening. We have to be open to listening. And I think when you and I went to school, no one was interested in what we had to say as a student. In fact, you were probably afraid to say much, like I was.
Absolutely.
For retribution was not a state or federal law that you had to worry about. But now I think it's really a different generation, and we have to be open to suggestion and recommendations. And some of that's a good change, because we don't always know what we're doing wrong if we don't get the feedback. And if we're providing the education, they're our customer. And I agree with you. Students come first. It's a very student-focused approach at Western, because they're our customer, and the customer's always right. You heard that since you were a child. The customer's always right. And if we look at who the customer is, if we're truly here to educate, then it's the student. So we do things like a town hall with the dean. We have a shared curriculum with our osteopathic colleagues, and like you do. So we have a town hall where both deans are there. I've missed the last few, but both deans are supposed to be there. And we get the feedback. We have assistant deans there for student affairs, so they're also taking note of comments. We also have our own college town hall with the students, so that they can provide us that feedback. I also have made sure that everybody knows, just email me, reach out to me, call me, whatever it is. You can always give me that feedback. I can't always promise we're going to make a change that you want, because it doesn't mean it's necessarily best for the student, but we're always willing to listen to what that student has to say. That 360 evaluation concept is really important, and same with continuous quality improvement. And that's what we're really striving for.
Yeah, I agree with you. I think students need a voice, of course, and knowing that you're available and you've got an open door and you're there to help them, because it's not oftentimes, or it is often, that we're not dealing with academic concerns with students. It's lifestyle concerns, it's family emergencies, it's the support they need outside of just the academics. So it's important to have an open door, I think, too.
Their wellness and their, especially nowadays with all the things that have happened in the last 3 to 4 years, with a pandemic. I mean, we never went into medicine thinking we'd see a pandemic. We knew that to be the flu in the, early 1900s. Who would have thought a pandemic would hit? We'd all be isolated. We wouldn't have social interactions the same way as we know. And then we have wildfires through Oregon and California. That hit many of our students personally.
Right.
We had all the social unrest that happened, and racial inequalities, and we still fight that with disparities in healthcare. And all these things that came on to people, that was hard for us to handle at our age and our, maturity or lack thereof some days, but maybe. And, then I look at it and say, well, what about my children? They're about the same age as some of these kids. My daughter's 21. Like I said, my son's 18, and seeing their friends go through it. Well, our students aren't that much older. So knowing how they may or may not be able to handle it, they really needed that guidance and that support. So being available to them was really important, and still is. Going forward, that won't change.
I agree. I have to commend our students. They were so professional, so respectful, understanding that we were making curriculum changes. I'm very proud of the classes that went through the pandemic, for sure.
Yes. It was a tough time as an educator and as a student.
Absolutely. So, I wanted to move on to some of the challenges we have within the profession. And I've always talked about the need for shadowing. If a prospective student goes to a podiatrist's office and they see a doctor who's just loving his job and he's doing surgical cases and has a great mix of inpatient care, inpatient and outpatient care, the student's always impressed. They come away and the doctor's enjoying his job, and the students say, "Oh my gosh, I had this shadowing experience. It was awesome. I can't wait to become a podiatrist." But then on the flip side of the coin, our profession is experiencing a dip in applications with student recruitment. So it's kind of a dichotomy, if you will. And I was wondering what your thoughts are on that.
Well, it's certainly a dichotomy. It's and certainly a challenge right now for all of us that we're all going through. And I really appreciate the collaborative approach that so many of us have, because that'll really elevate all of us together, which is important. That really strengthens the profession. It really strengthens us, as really is a specialty of medicine, which is where we are and where we need to be. The fact that people shadow love it, I hear that all the time. "Oh, I shadowed this person and just a great experience. I can't wait to be just like they are, or have that type of lifestyle or that type of practice." And I think the issue really lies in awareness. The more people know about us, the more people who shadow, the better off we'll be. And the word isn't out there. Many people either don't know what we do, or they still think of us as a chiropodist from many years ago, when our field has evolved so much, and it's not always recognized. And that's a shame, because they're missing out on just a great opportunity.
Yep, it is a shame. And sometimes it pains me when students apply to the school and they come in and they say, "Oh, we thought that podiatry was just an offshoot of allopathic medicine. It was a specialty." And they didn't realize it was a different application process, a different educational experience, a different accreditation process. And I think you're right. A major branding campaign for our profession, I think would help a lot. And then our jobs, at the colleges, we're all working really hard and collaboratively and through the AA, and our students are off doing suture workshops and taping workshops. So we appreciate and we love working with your college when we do collaborative events out here on the West Coast. So hopefully
I hope we can do more.
I think we need to do more. There's no doubt. We touched on this just briefly, but with the 2 new colleges on board, there's just tremendous opportunities within the profession. What advice do you have for new colleges coming on board to survive the times and become work through the accreditation process?
That's a tough one. It's tough because there are so many things to do just to get the college started, and you're so focused on just trying to do the right thing to get it started. I think the biggest thing is don't be afraid to do the wrong thing, because you're still doing something. Just recognize it and change. Yep. But don't stay in the wrong.
Yeah. And reach out to us. I mean, I've talked to Dr. LaFontaine and Dr. Lee, and as a profession, we get together with the AA and do the curriculum guide, and there's no reason why we can't always reach out and help them. I know the deans did it for me when I was a new dean. So
and they've done it. They did it for me. And I've since reached out to both of them to offer our support. Reach out. But the biggest thing is to act. Whether it's reaching out, whether it's your curriculum being developed last minute, like we did many times in the beginning, just keep moving forward and you'll be fine, and do it collaboratively.
I think so. And I also think it's a good thing for the profession. I mean, if you look at the Texas school, for example, they're recruiting from within the state of Texas. And, if the more awareness there is about podiatry, when they fill their class, it may carry over to other colleges and schools. So I think awareness, like you said, is very, very important.
Yeah. And I think that, 2 new schools, people have all been upset. Why are we opening schools if the pool's so low? It's a tough time to open schools. It's tough to swallow when we have to go back to our universities and explain why our numbers are down with our 2 new schools and so on. But ultimately, it's a good thing for the field. And it's just maybe a tough year to see that happen, but it will help us in the long run. And we have to look in the long run. We can't always worry about today.
I think it's good. And I also think a competition makes everybody better. So I
yes,
welcome it.
Absolutely.
All
Absolutely.
right. So let's shift gears a little bit. Can you tell our audience something about you that they would have no idea you're involved with or is a passion for you?
I think really sports are the biggest passion I have is just watching sports since I can't really play them anymore. So too many injuries or just bad back and other issues, but just, going to sporting events and enjoying the people you're with and relaxing and having a good evening and or watching them at home many times. It's just to relax and spend time with the family and be together around something we can all get behind. And I think that's a great opportunity is to connect with people.
Yeah, I agree with you. Sports is a big social connector. So back in the 70s, when you were a Bullets fan, I was a Bucks fan. And I remember when the Bucks won their first championship, and I followed them every year. And it took 50 years to get another championship a couple of years ago. So we have shared interests for sure.
Well, but you're ahead of us because the Bullets haven't done anything since.
No, I hear you. So how about a couple just oddball questions? Like what's one of your favorite books, or what have you read recently?
I read all of the Vince Flynn series. He's one of my favorite authors. Lee Child is another one. So I read all of their books, and I realized that I had missed a couple. So I have a long drive into the office to get to the school. So I've been doing more books on tape. And so I got caught up on all the Vince Flynn and Lee Child of the last couple of years I'd missed recently. And I enjoy reading their stuff.
That's great. How about this one? Where's your favorite vacation destination?
I don't know that the destination always matters. I really enjoy just going on a trip with my family. So to me, the destination is kind of secondary to that because it's a chance to get away. I'm sure you're the same way. We work way too hard. We spend too much time away from the family, and getting that time to be with them and just spend time, I usually let them pick the place. So it seems like we've gone to Hawaii a fair amount of times. So that's probably a favorite place just because we all get to enjoy going there.
Oh, that's great. You recently took on another role with the American Diabetes Association. And as if you didn't have enough on your plate, right? But we're talking about the Limb Preservation Alliance Group. And how'd you get involved with that?
So I reconnected with someone from the Diabetes Association just recently as dean. I had been involved with them several years ago on their LA County leadership board. And I was on the leadership board for a number of years and president of the board for 1 year. And then I took some time away with the school and doing other things. And then reconnected with someone from the ADA who was in California at the time and is now national. They had told me about this alliance and asked if I would join the advisory group. And so I said, yes, I think it's important to give back, not just at the university and committees and other work that way, but in our communities to try and make our communities better. I think it sets a great example for our students, but most importantly, for my kids.
It's a great role, and it's one that you can certainly add significant value to. So congratulations, and,
Thank you.
And we appreciate your efforts on behalf of the profession with the ADA. I think that's fabulous. So let's flip the roles around. Do you have any questions that you'd like to ask me?
Yeah, so I know that you've moved around you were in Denver for a while, I think, right? And then you went to Barry and Midwestern. And where do you see yourself? Where do you see yourself taking this school and other things in the future?
That's a great question. So yeah, I was in Denver, Colorado in private practice and ran a wound care center for 17 years. And during that time, I was able to work with my colleagues in Denver, and we started the North Colorado residency program. So it became quickly evident that I loved training residents, and I was also the clerkship director. So all the students from the different schools would come through our program. And then when I had the opportunity to go to Barry University, that was a major decision for our family. South Miami is not Denver, Colorado, of course, and but it was just a phenomenal experience, and Barry University is great. They were very kind to me. My parents had some issues with Alzheimer's and some vascular dementia. And I actually stepped down at one point and became the senior director of research because we had a bunch of research grants. So I was cruising along in that role. And then I got a call from Dr. Jeff Page, who was the previous dean here at Arizona. And a funny story, when I worked up my first patient ever in my life, it was with Dr. Page because he was the dean of clinics at the California College of Podiatric Medicine. So you know how it works, John. You say, yeah, I might be interested. Next thing you know, you're interviewing, and next thing you know, you're moving to Phoenix. So this will be 6 years this summer that I've been here. It's a phenomenal university. They set the stage for us to be successful, both academically and financially. We opened up $1 million podiatric medicine learning center with power instrumentation labs and gait analysis labs. And, we've got everything from ultrasounds to non-invasive vascular machines. So all of my dreams in terms of what I can put together for students are here in Arizona. So, as you know, we work together on the board of directors for the American Association of Colleges of Podiatric Medicine. I'm at the stage now where I'm also, giving back as much as possible and helping students with research and funding some of their student-initiated research objectives. And I'm just really enjoying the administrative role that I'm playing at the university. And I don't see anything changing in the short term. If you're loving what you do, you might as well keep doing it. So thank you for asking.
Well, I'm glad you're doing it. It's been nice working with you, and I enjoy it. And I know we're going to be able to do some great things between our schools together. So,
I look forward to it for sure. And thank you for asking that question. John, I know we could talk forever. We could do this for hours. But are there any last thoughts you might have for our audience?
Sure. I think the most important thing is touching back on what you said about our applicant pool and what we're missing. And I'd mentioned that awareness. And I think it's just so important for people to know you can shadow a podiatrist and get really interested and pursue that. But it's been a great field. It was a great decision I made a long time ago. It's really provided me the ability to support my family, to not have to worry about everything. It certainly has just been a great opportunity for myself and my family, and it's given us everything we need and some things we want, and goals to move forward of other things we may want. Maybe you work harder some days, maybe you do other things, but it's provided a great life for my children. So I'm really grateful for that.
Well, I speak on behalf of the profession that we are so fortunate to have you as a dean at the Western University College of Podiatric Medicine. You do great work, and I also look forward to collaborative efforts. John, we appreciate you sharing your experience, your knowledge, your expertise. I can't thank you enough for being on the Dean's Chat today.
Thanks so much, Jeff. It's been fun.
Well, I also want to thank all of our listeners for joining us on Dean's Chat today. This podcast will continue to highlight leaders and voices in our great profession. So we'll see you next week. Please don't forget to give us a 5-star rating, and cheers till next week. Bye-bye now.